Dear ladies and gentlemen, it is nice to meet you. My name is Alexander Rokitansky. Currently, I am the chief surgeon at the Wiener Privatklinik. I have 3 professional medical degrees. I am a specialist in general surgery, in pediatric surgery, in adolescent surgery, and a specialist in pediatric intensive care. As a surgeon who also operates on newborns, I am routinely used to the delicate handling of fragile tissues on a daily basis. Until my scientific graduation and habilitation in 1994, I was assistant and then senior physician at the large second surgical university clinic in the General Hospital of Vienna. Subsequently, for 24 years, I was in charge of one of the almost largest surgery departments in Eastern Austria for children, adolescents and adults, with surgical diseases focusing on malformations and maldevelopments requiring surgical therapy. 46,173 operations were performed under my chief medical direction. Since now, I personally performed 7,238 operations. With the tools of decades of exceptionally broad surgical training in adult and pediatric adolescent surgery, as well as intensive care medicine, I am now responsible for the consolidation and expansion of maldevelopmental and malformation surgery in the Vienna Privatklinik, which affects children, adolescents and adults. These fields are in addition to the range of well-known responsibilities in my position of the chief surgeon. In addition to all common surgical procedures for children, for example, inguinal hernia, undescended testicle, umbilical hernia, circumcision, and especially the treatment of hemangiomas, or sometimes also intractable constipation, my specialty is the treatment of thoracic wall maldevelopments. In addition to the pressure on the heart and the lungs, with a demonstrable reduction in output and performance, breast augmentations desired in ladies seen from aesthetic dimension can fail due to the pectus excavatum rib cage. You can find an overview on the internet portal KidsDoc or EDOC. Since I was able to design and successfully develop a total artificial heart called the Small Viennese Total Artificial Heart with a team at the Second Surgical University Clinic in the General Hospital in Vienna at the end of the 1980s. And this heart, as a bridge to human heart transplantation, I have turned increasingly during the past 27 years to thoracic surgery in children, adolescents and also adults, and have worked here, for example, in the pectus excavatum correction with striking successes for patients. Some evocations to the topic. Any sport is possible after the surgical correction. There are patients who even successfully participate in the Ironman competition with my metal implants in situ. Since today I have performed 821 surgeries on pectus excavatum, other name funnel breast, and pectus carinatum, other name keel breast patients. My treatment measures, which have been tested on hundreds of patients, focus on special surgical steps, the use of one-piece implants without metal abrasion, and also the use of conservative treatment methods additionally. The latter is the individually adapted vacuum suction belt treatment, which if used early enough can sometimes also prevent surgery. In the Vienna Privatklinik, you will find top specialists in an excellently equipped clinic that distinguishes itself through a human and professional committed team. I would be very pleased to welcome you personally in the Vienna Privatklinik, where I also run my private office. In special cases, I will personally bring in my decades of surgical experience and include you in my personal surgery program. Thank you for your attention and goodbye.